When it comes to your health, one of the biggest questions people ask is, what should I actually call my doctor about? And honestly, that confusion is very common. So today I want to walk you through the symptoms nurses never ignore when we see them in patients, so you know when something needs attention. Hi, I'm Fairchild. I'm a registered nurse with over 15 years of experience, and I created this channel to talk about health and wellness in a simple, clear, and honest way, without medical jargon or fear-based advice. This is a no judgment zone. If something feels off, you deserve answers. If this sounds helpful, please like and subscribe so we can keep having these conversations. Number 1, chest pain or pressure. When someone tells me they're having chest pain, I listen very closely to how they describe it. I get concerned when it feels like pressure, tightness, burning, heaviness, or pain spread to the arm, jaw, back, or shoulder. Chest pain can have many causes, but when it's described this way in these areas, as nurses, we don't ignore it. At that point, a deeper assessment is needed, and 911 may be called because this could be an emergency. Number 2, trouble breathing. Shortness of breath is a big one. As a nurse, I worry when you can't finish a sentence without stopping. Breathing feels harder than usual. You're breathing fast, even while resting, or laying flat makes breathing worse. We assess to understand what might be causing this, which includes checking oxygen levels using a pulse oximeter. If oxygen levels are low, this requires an immediate trip to the emergency room. Number 3, sudden confusion or behavior changes. This one often gets missed, especially because you might not notice it happening yourself. As nurses, we take notice when someone becomes suddenly confused, acts very different than normal, is hard to wake up, or says things that don't make sense. Sudden mental changes are never just age or just being tired. If this is new or sudden, medical attention is needed. Number 4, sudden weakness, numbness, or trouble speaking. If one side of your body suddenly feels weak, numb, or heavy, if your speech becomes slurred or hard to get out, or if you smile and one side of your face droops, that is an emergency. Time matters with these symptoms. As a home health nurse, I'm calling 911 and sending you to the hospital right away. Number 5, fever with other concerning symptoms. A fever by itself isn't always dangerous, but as a home health nurse, I always recommend notifying your doctor about fevers, especially when they come with other symptoms like chills, confusion, shortness of breath, worsening pain, or feeling unusually weak. In general, a fever is anything over 99.9 degrees Fahrenheit or 37.7 degrees Celsius, unless your doctor has given you different guidelines. If you have a specific plan from your provider, always follow that plan. Number 6, heavy bleeding that won't stop. This one is straightforward. A small cut that bleeds is one thing, but as nurses, we get concerned when bleeding soaks through the bandages, doesn't slow down, or happens along with dizziness or weakness. Bleeding that won't stop needs medical care. Number 7, severe pain that comes on suddenly. We worry when pain comes out of nowhere, keeps getting worse, doesn't improve with rest, or feels very different than your usual pain. Pain is one way your body communicates that something isn't right. If you're unsure whether your feeling is serious, call your healthcare provider's office. They can help guide you on what to do next. But because these symptoms can be time sensitive, there is absolutely nothing wrong with seeking immediate attention or calling 911. You're not overreacting by getting checked. Also, make sure you follow up with your in-office doctor visits when recommended. Those visits help catch problems before they become emergencies. If this helped you, save it or share it with someone you care about, because knowing what not to ignore can truly make the difference. I'm glad you're here, and when health information feels confusing, it's okay to just ask a nurse.